everyone. I'm Margie Taylor, your host for Conroe Culture News. And today I am visiting with Assistant Living Locators of Greater Northeast Houston, Brent and Pauline Veazey. And they are excited about their new business and helping your loved ones find where they need to be. So they are going to tell us all about that. And this is sponsored by Team Sinisi and Roger Stein Chiropractic. We are also on FM 104.5, 106.1 Lone Star Community Radio in downtown Conroe. So thanks for coming on today, guys. Tell me a little bit about your business and how you got into this business.
Well, thank you for having us today, Margie. We've always had a special place in our hearts for seniors. I've had experience with seniors at the YMCA for over 15 years. My husband, Brent, was in the Medicare world and insurance, and he spent plenty of time there and also with the YMCA. So we've always had a special place in our heart for people over 65.
And when the pandemic hit, and I lost my position at the YMCA last March, I was kind of exploring the world to find out what would be the next professional adventure I would be going on. And when I found this opportunity with Assisted Living Locators from a franchise perspective, it seemed like it was a very intriguing opportunity because not only do we have this previous experience that we've lived through our professional lives, but we've lived this journey personally as well. We both have older parents, and we were both involved with my grandparents' care over a decade ago. And that journey with my grandparents was extremely difficult. We ended up having to move them 3 times, and we had family fights, yelling, shouting matches.
I can relate.
And so it was not a very good, positive experience at all for all of us. And it was something that left a very lasting impression with me and Pauline both. And so when this opportunity came, it was viewed not only as a way to actually start a new business and control our own lives better, but it was an opportunity to actually help people avoid the experience that we had, which was extremely negative and has lasting impacts even to this day with some people in our family. So that's why we kind of got into this, and everything we do is free. It's free of charge for caregivers, the person, the family. So we get our payments from, the resources that may eventually get referred to. And, but that's how we work.
Yeah. And it works really well. I know that I have reached out to y'all, and I've noticed your posts on LinkedIn, and they are very compassionately done and have a lot of great information and resources as well. So the interesting thing about what you do is they don't have the parents or whomever, your loved one, does not have to live here in Conroe, Montgomery County, or Texas for that matter, correct?
That's correct.
Right.
So you help out wherever they want to be or where is the best suited place for them, correct?
Absolutely. So what we do is whenever someone reaches out to us and says, Mom needs some help. Like, we don't know exactly what she needs, but it's not working. So we have an in-depth conversation and, what do you need? What are you looking for? What are you seeing? Mom's in, Kentucky, and I really need her to be closer to my sister in Florida. We can help with that. We do specialize locally because we have a great network of people we work with through the chamber and through different organizations where we work locally with people. But we can help you no matter where you live in the United States.
It's pretty amazing.
It is, and the local area, it's a marketing area. So our marketing area is really from the 2nd Ward in Northeast downtown Houston all the way up Interstate 69 to Cleveland. And then you go east from Cleveland down into Liberty County to Dayton, and then further southeast to Mont Belvieu, and then basically Anahuac. So basically I-10 east and I-69 north. That's our marketing area, but we do work. I mean, we're helping people here in this area right now.
So when you say marketing, does that mean like the first touch, of getting involved with somebody? So not to say that I couldn't refer you to somebody in Oklahoma, let's say, that's a warm welcome. It's not you cold touching them for the first time.
Correct. I mean, if you're looking for us on our website, you put in a zip code that's in those areas
Right.
that we discussed, they will find us.
Right.
Okay.
Okay. Yes.
So otherwise, we're there
It's
to
the
help.
relationship
It's relationship like yours. You
Right.
reached out to us. Some other friends of Pauline's have reached out to us, and we help them, regardless of wherever they are.
No, and you do it really well. So if you want to help, like my mother who lives in Oregon, find a place for her to live in Arizona or California or wherever, you would sit down and that individual would give you all the specifics of how much they can spend a month, what their needs are, and there's different levels of care, right?
Absolutely. So some people don't need a whole lot of care. They just need somebody to make sure that they're eating every day or make sure that their laundry gets done because it's a little bit more difficult. Some people need reminders that they have medication they need to take, and some people need someone to give them medication. So there are different levels of care, and we work with all levels, all the way from independent living, which means you just need somebody to make sure mom's there and check on her every once in a while, to, we need full-time 24/7 care. So we help all the way through memory care.
And we help not only with people staying in their own homes, because 90% of people want to stay where they're at. That's
so
their
you
preference.
can bring in care
Absolutely.
to them.
We bring care into the home to help them be able to live their best lives in their homes. We have people that can come in and evaluate their home from a safety perspective and say, okay, what do we need to do to make this a more safe environment for them to try to lessen the risk of falls. You can't eliminate falls, but you can lessen the risk of falls by putting in rails, ramps, other things to help people get around and be more mobile within their own homes.
Rearranging the furniture.
Rearranging
so
the
it's not in
furniture, making sure you don't have rugs on the floor,
Sure.
those types of things. So we have resources that can be brought in to do those things. We have resources that can come in and help people get dressed, eat, help them go and take a bath if that's what they need. Anything and everything is on the table that we can do within their homes for sure.
So it's an exciting opportunity because the population, first of all, is getting older.
Absolutely.
Like myself. I mean, they call it baby boomers because that's when most babies were born. And now, everybody gets older and may need more additional care. What is the average age of the person, the individual that you're helping at the end game?
Well, currently,
probably in their 70s but we've helped people as young as in their 40s just because they had a disability. And so we were able to work with them a little bit. We've worked with people that are, centurions, so they're over 100.
Yep.
So yeah, we help a little bit of everybody.
And just to go back to what you were saying, did you know that every 8 seconds, someone is turning 65 now in the United States?
Yeah.
Every day. 10,000 people a day turn 65.
And by 2050, 20% of the U.S. population will be over 65.
I will be over 65. Well over.
So I will as well.
We will too by 2050.
Yeah.
My. And it's at no cost to you. That's what people need to really understand, that, you're helping them, and wherever the situation is, wherever they end up, they would pay. So if they're staying in their own home, who pays for that person to come in and assess the home?
So for the assessment, the majority of the partners we work with in the Houston area, they do an assessment of your home and at no cost. It's what you do after that. So you find that you have, you need rails, you need shower.
You got to pay for that.
Yeah, you would pay for
You're
that
paying
service.
for a service.
Right. But for the assessment, no, yeah.
But that's a good question, Margie, because it talks about a bigger issue, because a lot of people think that there's like an insurance out there, especially Medicare, will cover the cost of these types of things. And Medicare will cover home health. Okay, so if someone needs something to be put into their veins, Medicare will actually cover for that to happen. But if someone needs to go into the house and make these changes or to help them get non-medical stuff, for the most part, Medicare's not going to pay for that. Okay, so there's only 2 types of insurances that will cover the cost of what we call long-term care moving forward. The first is Medicaid. Okay, Medicaid is an income-based. It's designed for people with a lower socioeconomic standard, and it will cover for people to come into their home to take care of them or to move them into a long-term care, assisted living, or whatever facility they would need. Okay,
But not all places take the Medicaid.
No, not all places. In fact, in Texas, very few places take Medicaid. Okay. So the second option that's out there is something called long-term care insurance. Okay. It's a special insurance program that is designed for people that will pay for long-term care in a home environment or in another facility environment place.
But you got to pay for that up.
That is
previous to when you need it.
true.
Right?
Absolutely.
Yes. And the younger you are, the cheaper it is for you to buy into it. Okay. So if you're in your 50s right now, this is something that you should probably be looking at because it takes a few years to build equity into the plan. And there's different types of plans as well. They have fixed benefit costs versus pay as you go options that are shorter term as well. But long-term care insurance is basically the only other way to pay for it other than out of pocket or if you have veterans
VA benefit.
VA benefit.
And you help them with VA benefits to
We
figure
can,
out what
yes.
can be used.
Yes.
and
Absolutely.
all of that, and places that would take that.
Yes.
Do some places not take that?
Yes.
Okay. So
It-
it's like
it-
anything
but it's
else.
not as broad as Medicaid. Most of them will, because what the VA does is actually reimburse people
For
for
the
their
cost.
expenses. So my grandfather was in the VA program, and we should have investigated that further because he probably would have qualified for long-term care under the VA program, and we just didn't know about it at the time.
So-
But typically people that have been in wars, right?
Right. So there are requirements for days of service within wartime, and so there are some requirements for it, and there are income-based requirements for that benefit as well. But I think a large part of what we do is we educate people because a lot of people, like he said, don't know about the VA benefit, or they don't know that their family member might qualify for Medicaid because it's just something that you don't think about and you don't talk about a lot.
Well, and that's very true. They don't want to talk about it.
Right.
Or in some cases, they may think that their medical will pay for it.
Right. Absolutely.
And it doesn't.
Absolutely
Does
not.
Medical pays for medical. It doesn't pay for anything like your housing.
Right.
Nope.
And these are it's difficult conversations for people because we're talking about things that people don't want to talk about. You don't want to talk about your finances with other people, and you don't really want to talk about the emotions that are involved with, mom's getting older or I'm getting older. And so those are difficult things to think about, but we need to think about them because the more time we have, the better we can plan and ensure that you're getting what you want out of the last years of your life, that you're determining what that looks like.
That's good points. So how does someone get in touch with you?
So there are quite a few ways. We're on Facebook. You can like us at ALLNE, so that's Northeast Houston. We're on Instagram at Senior Choices. We have a phone number, which is 281-691-6450. And of course, on our website at assistedlivinglocators.com.
And the phone number you can not only call, but you can text as well.
Absolutely.
So the texts come directly to both of our phones,
Yep.
and the phone rings to both of our phones, and they're on all the time.
Absolutely. We answer those phones pretty much 24/7.
Wow.
Yeah.
So this is quite different than the YMCA.
Oh, yeah, it's a lot different and a lot the same. We were both very intentional that whatever we did for the next steps in our professional life, we had to be taking care of people. And so this was the perfect choice for us.
It's
So
very
really
different
good.
than the corporate world for sure
For
that I
sure.
was in. And there's a lot of things. We were involved with my grandparents because we were in the Medicare sector.
Right.
Okay. But just being in the sector doesn't get you into the nitty gritty, the nuts and bolts of what the day to day is out there. And there are so many different things that are available, so many different aspects you have to consider. It's very complicated and it can be very overwhelming. And a lot of people have experienced that and come to us, and
They rely on you to know the answers because it is
Correct.
complicated.
it is so complicated.
And you don't want people to scam you because people are going to sell you something.
Absolutely.
If you call a number on your own, forever they will have your number and they will be calling you. So
Right.
if you go through someone like yourselves, then that is not going to happen.
We are the buffer, so we make sure that people don't have your contact information so that they can constantly
harass you.
I was not going to say that.
Well, I am.
But
I can. Yeah.
So, well, and it's easy for people like in our generation, yourself included, where we will Google stuff, right? So I need to Google the best care for mom, or I need to find mom a place, and that's fine. But once you fill that form out on that
You're
website, 20 people
They got
have
you.
your information, and they will call you until you.
Incessantly.
Yes,
They'll
and
call, they'll text, they'll
keep
send
calling.
an email. They'll keep calling, even when you tell them not to call. So, word to the wise, they should connect with y'all, especially if they're semi-locally in the area, or through a friend that you know, somebody that may need this, to reach out to either one of you, both of you, or whatever. Go on your Facebook page, go on your website, and of course we'll have all this on Conroe Culture News. But it's going to happen, and you will need assistance at some point. So this is good information. So I know, Brent, you wanted to also tell me, we don't have too long here, but tell me about the Alzheimer's Walk.
yes, we Assisted Living Locators is partnering nationwide with the Alzheimer's Association. Alzheimer's is the leading dementia in the United States. Almost 6 million people currently have it, and by the year 2050, that will be 14 million. So
You keep talking about 2050.
yes, that's kind of
That's like 30 years from now.
yes, 30 years from now, but it's the sixth leading cause of death for people over 65 right now, and it's going to be by 2030 the third leading cause of death, only behind heart disease and cancer.
Wow.
Yeah.
And having experienced it personally, it's a very horrible disease, and there's no cure for it.
Yeah.
None. So it's something that we as an organization believe strongly. We want to support it. And we've already had the longest day happen. And Pauline is actively involved with the organization and coordinating a lot of things. And one of the things we have coming up is the walk. So Pauline, can you talk a little bit more about that?
In October, we are doing a walk to end Alzheimer's. So we're going to be actually at the walk in the Woodlands. So we're working with that organization in October, and then there is a second one in October that's also in Baytown. So we do have teams at both of those events. So if you would like more information, obviously just send us a message, and we'll be happy to put you in touch with our walk team, and we'll be able to get you coordinated and hooked up.
Currently, we spend $353 billion every year to treat Alzheimer's and the other dementias. By 2050, that will be $1.1 trillion.
Yeah.
So that's it's not only about the lives that are going to be directly impacted, because there's 11 million people every year that care for Alzheimer's patients as part of their families. They're not getting paid. So that's 11 million people that are no longer in the workforce that are trying to take care of their loved ones as well. So it's a disease that has not only a very horrible physical impact, it has a very horrible social and financial impact on all of us. And it's something that we need to try to do to take care of it.
Yeah, that's good information. You guys have just had a lot of great information. So I want to recap on this. You guys are with Assisted Living Locators of Greater Northeast Houston, Brent and Pauline Veazey. You have a Facebook page, ALL Northeast Houston. You're also on Instagram as Senior
Choices.
Senior Choices, I thought so. And your website is assistedlivinglocators.com, and then just go Northeast Houston. Right. You'll find your way there. Or just
Absolutely.
look up Pauline Veazey, Brent Veazey. Find them and talk to them. She's also at the Conroe Chamber. And anyway, I want to thank you both for coming on the show today. I really appreciate it, on Conroe Culture News. And I am Margie Taylor, your host for the show. We'll be right back in just a moment for the bottom half of the show.
Team Sinisi is a proud sponsor of Conroe Culture News. Vinny Sinisi and his professional team provide comprehensive real estate services throughout the greater Montgomery County area and beyond. Whether looking to buy, sell, or invest in real estate, Team Sinisi has an impeccable reputation. Contact Team Sinisi for a great experience at teamsinisi.com. That's TEAMSINISI.com.
Since 2004, Roger Stein Chiropractic has offered spine and joint manipulation services to residents of Montgomery County and surrounding areas. Conditions treated include lower back pain, migraines, headaches, whiplash, carpal tunnel, neck pain, sciatica, joint pain, sports injuries, herniated discs, and complications from pregnancy. Roger Stein Chiropractic, led by Dr. Stacy Rogers and Dr. Brian McGee, is an integrity-verified chiropractic clinic. Call 936-441-9990 for an appointment or visit rogerssteinchiropractic.com. That's RODGERSSTEIN chiropractic.com.